Commitment is what brings us all here today. The safety and the well-being of our staff and our students has been and continues to be my #1 priority. After continuing to work with Dr. Dina Hinshaw's team and Alberta Health, emerging evidence has made it clear that masks can play an important role in limiting the spread of COVID-19 in our schools. As a result, mask use for students in grades 4 to 12, as well as all school staff, will be mandatory when school returns for the 2020-21 school year. Staff will be required to wear masks in all settings where physical distancing cannot be maintained, and students will be required to wear them in all shared and common areas such as hallways and on school buses. Mask use for kindergarten to grade 3 students will continue to be optional. This is because mask use for younger children is a challenge due to difficulties with proper fit and compliance. Additionally, current medical evidence indicates that children under 10 may be less likely than older children or adults to transmit COVID-19. I know Dr. Hinshaw will have more to say about this very shortly. We do not expect boards, teachers, staff, or parents to shoulder the financial burden associated with this new rule. To assist with these new guidelines, Alberta's government will provide every single kindergarten to grade 12 student with 2 reusable masks. This will ensure that students who are required to wear masks will have them, and will allow for our kindergarten to grade 3 students to have masks should they wish to wear them. We will also provide all of our teachers, support staff, school staff, and bus drivers with 2 masks. In total, more than 1.6 million reusable masks will be provided to 740,000 students and 90,000 staff across our province. Additional single-use masks will also be available at schools in case students or staff misplace or forget their masks. Additionally, teachers and support staff, school staff, bus drivers will all receive 1 reusable face shield for their use in schools. 53,000 of these face shields will be provided from a generous donation offered by the Canadian Shield, with the remaining provided by Alberta's government. The use of face shields will be at the discretion of the individual staff member. While face shields can help reduce exposure, they are not equivalent to masks. That is why staff who choose to wear a face shield will still be required to wear a mask. As part of our school reentry plan, we indicated that entrances to schools and classrooms will require hand sanitizing stations. To assist our schools with stocking up on sanitizer, Alberta's government will provide approximately 466,000 litres of hand sanitizer to our school authorities across Alberta. The specific volume provided to an individual school authority will be based on student population. We will also be providing every single school, whether it be a public, separate, francophone, charter, or independent school, 2 contactless thermometers to assist with managing student and staff health. Thermometers use will be at the discretion of the school authority. All of these supplies will be distributed to school authorities prior to the start of the 2020-21 school year. Once received, each school authority will then distribute to their individual schools, staff, and students. To help reduce absences, my department is also working with Alberta Health and Alberta Health Services to explore the possibility of expanding testing capacity and reduce turnaround times for testing for school staff, teachers, and students. Today's announcement is a direct result of Alberta's government continuing to listen to expert medical advice, as well as our commitment to working with our education system. Our school authorities are already developing return-to-school plans that meet the needs of their own communities, some of which have already been released. Alberta's government will continue working with them as they work to adapt our guidelines to their own local context. We will also continue to work with our school authorities to ensure that they have the support they need and are well equipped for a safe and successful return to school in the 2020-21 school year. Our guidelines for school reentry will continue to evolve to ensure they reflect the most up-to-date medical advice. I want to thank Dr. Dina Hinshaw and her team at Alberta Health for continuing to work with my department and our education system, and for being a strong partner in doing whatever we can to ensure a successful and safe return to school. Before we turn the floor over to her, I will now turn it over to Bevan Davrin, the President of the College of Alberta School Superintendents, to say a few words.
Thank you, Minister LaGrange. Good morning, everyone. I think by this stage, we certainly all recognize that this is a shifting landscape in dealing with the challenges that this pandemic has brought, and it is important to be responsive to those changes. Over the month of July, we saw small adjustments to Alberta Education's School Relaunch Planning Guide that was released back in June, and are pleased again to see that Dr. Hinshaw and Minister LaGrange are continuing to monitor the situation and continuing to make necessary adjustments to keep students and staff safe. CASA's board of directors, from all of us, we appreciate the willingness of government not only to be responsive, but also for their continued collaboration as these guidelines are operationalized in Alberta schools. We also appreciate government support with the protective equipment and the supplies, as these items are an integral part of those operational plans for school divisions in September. Thank you.
Thank you. And now I will ask Dr. Dina Hinshaw to come and say a few words.
Thank you, Minister, and good morning, everyone. As Minister LaGrange mentioned, after completing our review of current evidence, I am now recommending that non-medical masks be worn by staff, teachers, and students in grades 4 and above in Alberta. This means that when classes begin this fall, masks will be mandatory for students in grades 4 to 12 and all staff and teachers outside the classroom or when activities inside the classroom involve close interactions. This means that students in grades 4 through 12 will be required to wear masks while in common areas, outside the classroom, and on school buses. To be clear, masks are not required inside the classroom when students are seated and the teacher is distanced from the students, though they can still be worn if a student or teacher chooses. However, they are required in hallways and any shared places where students, staff, or teachers may not be able to maintain the recommended physical distancing requirements. This is similar to the approach being adopted in Ontario, Quebec, and Nova Scotia. It is an important measure to help minimize the risks of catching and spreading COVID-19. The question that many parents may have is why we are making that decision now. When Minister LaGrange announced on July 21st that in-person classes would resume this fall, I noted that my team was reviewing the current guidance, including evidence from jurisdictions around the world. Today's announcement is the result of that detailed review. Since day one, we have committed to acting on the best evidence available at any given time. This means not relying on any single study or jurisdiction's experience, but methodically assessing all the evidence available and then acting on that information. We know that masks can be an effective addition to reducing COVID-19 transmission when used properly. That is why I continue to strongly recommend that all Albertans wear masks in indoor spaces where distancing cannot be maintained, regardless of age. However, we also know that schools are unique settings where special measures are needed to mitigate the risks of exposure. There is growing evidence that wearing non-medical masks can interrupt transmission in public indoor spaces, including in school settings with older children. After reviewing the literature, I believe that requiring masks in all staff and in all children grades 4 and above is essential to limiting the spread within schools and protecting the health of everyone involved. Why are we using grade 4 as the cutoff? Because of emerging evidence that shows children who are 10 or older may be more likely to transmit COVID-19 than younger children. Also, they are further along in their development and so better able to wear masks appropriately and safely. Mask use in children up to grade 3 can be considered, but this is not mandatory. There has been a great deal of focus on masks lately, but it is important to remember that they are only one part of the public health approach put in place to protect schools. Masks alone do not keep kids and schools safe from COVID-19. Indeed, no single precaution or public health measure will eliminate all risks of exposure in schools or any other setting. Physical distancing, cohorting, frequent hand washing, enhanced cleaning, and changes to how classes and schools operate are equally as important in limiting the spread of the virus in schools. There is still no risk-free approach to living with COVID-19. As I've said before, we have no choice but to learn to live with it. Everyone in the school community will have to do their part and follow public health guidance to keep each other safe. Jurisdictions around the world are trying to determine the most effective way to resume schools. We will continue to watch their experiences closely and monitor our own. If needed, we will continue to update public health advice for schools based on best available evidence. This is part of living in the new normal of COVID-19. We must be agile, adaptive, and guided by the evidence as it emerges. This is the best way to protect the health, safety, and well-being of students, staff, families, and communities. Thank you, and we'll be happy to take any questions.
All right, we'll open the floor up to questions. So, moderator, could you please put forward the first caller?
Thank you. Yes, the first question is from Tom Vernon, Global News Edmonton. Tom, your line is open. Please go ahead.
Hi, my question's for Minister LaGrange. Thanks for taking my question. We've heard a lot of concerns about class sizes since the announcement a couple of weeks ago. What work is being done by the government? Is any work being done by the government to find additional space if Dr. Dina Hinshaw determines that class sizes are becoming a concern?
Again, when we look at class sizes, if Dr. Hinshaw determines that we have to look at something different, then we would be looking at a different scenario. Scenario 2 of our plan limits class size, but right now we have indicated very strongly that we are going back in scenario 1 and continuing to work with school divisions. School divisions are adapting their plans to meet their local contexts as they move forward.
All right, moderator, could you please put forward the next caller?
Thank you. Yes, Janet French, CBC Edmonton.
Hi there. Thanks for taking my question. I think this could be for Dr. Hinshaw or Minister LaGrange. You said that you wouldn't need to wear masks in the classroom if you were able to stay physically distant. But we know that some Alberta classes, and we've seen teachers tweet out pictures of their classrooms and how close the desks are together. If the students are less than 2 meters apart, does that mean they have to wear masks in the classroom all the time?
In the back-to-school guidance, we've talked about different options for arranging desks so that students are not facing each other. And the recommendation, if 2 meters cannot be maintained, is that the seating arrangement ensures that students are not face-to-face, and that as much distance as possible is kept between the desks. The pros and cons of mask wearing in a classroom setting where instruction is happening need to be weighed out very carefully. If students or teachers are interacting in a way that's close and involves them working together, then mask wearing would be expected. But if students are seated in their desks, working quietly and not moving around, and the teacher is distanced from them, then mask wearing is optional in that setting, even if they are slightly less than 2 meters apart, with the rationale that the benefits of having interaction with the teacher can be really critical for people who are having difficulties with communication, such as those for whom English is an additional language, or those for whom facial expressions are a really critical part of communication. So in that setting, again, As long as the students are seated quietly, working quietly, and the desks are spaced so the students are not facing each other and as far apart as possible, mask wearing would be optional at those times.
Perfect. Thank you, Janet. Moderator, could you please put forward the next caller?
Lucy Edwardson, CBC Calgary.
Good morning. Thanks for taking my question. My question is in regards to elementary schools that cater to K to 6. How will you create an environment, or how are we expecting students to create an environment where half the students in a school are expected to wear masks and the other half are not?
Thanks, Lucy, for the question. This is absolutely an opportunity for learning for all our students. Oftentimes, our older students are very good mentors and guides for the younger students. So it's not unreasonable to have a scenario where the older students are wearing masks and the younger ones aren't. But definitely, the younger ones will look up to the older ones. And as we've said, if younger ones wish to wear a mask, that is absolutely acceptable.
All right, thank you, moderator. Could you please put forward the next caller?
Ashley Joanno, Post Media.
Hi, good morning. This is a question for the minister. You had previously said on a number of occasions that school authorities had enough money in their budget to meet the expectations of the re-entry plan. Now you appear to have acknowledged that they're going to need some help from the government by paying for the hand sanitizer and the mask. I'm just wondering if you could explain what led you to change your mind.
Well, we've committed all along to continue to work with school divisions and provide resources as are needed. Given the fact that we are now mandating masks for all students and for staff, we've gone the extra measure of providing those resources and paying for those resources. So this will cost an additional $10 million on top of the $120 million that is currently in addition to school that has been added to school budgets for the upcoming school year. We also have $363 million sitting in school board reserves that school boards have access to. And we've accelerated an additional $250 million in capital infrastructure maintenance and renewal, up and above the infrastructure maintenance and renewal dollars that school boards are currently given. So we are continuing to move forward and provide schools with the resources they require so that we can have a safe and successful reentry to school.
All right, thank you, moderator. Could you please put through the next caller?
Alicia Covella, Post Media.
Morning. Thank you for taking my question. I think this question maybe is for both the minister and Dr. Hinshaw. First of all, I just was wondering, we see these plexiglass barriers between all the, at grocery stores and that kind of thing. I'm wondering if there's been any move towards plexiglass in the classrooms, and what classrooms might look like come the fall. How will they be configured differently, if at all? And I have one more question, and I'm wondering about, Minister, what might happen to teachers, like elderly teachers or teachers with underlying health conditions who really are at quite a lot of risk to catching COVID and having a very severe outcome, it should be. And what kind of provisions are being made for those teachers? Thanks very much.
Thank you. So these are operational questions, which I do have the superintendent on the line, and he's able to speak to those. But I can just share that I know because we have roughly about 2,400 schools right across this province, and every school is configured differently. Classrooms look different in every school. As far as the plexiglass, there are certain school divisions that are looking at that if it meets their local context. And as well as teachers that are elderly teachers or have some underlying health conditions, that those are absolutely considerations that school divisions are working one-on-one with those individuals. Those teachers are need to go to their local physician and have that conversation to find out what is required for them to be safe, and then to have that conversation with their employer, which is the school division. And I know that school divisions are looking to accommodate those teachers, whether they they are working in other areas where they're not in direct contact with students or doing the online programming, et cetera. But Bevan, can you please answer some of these questions? Are you still on the line?
Yeah, certainly. And Minister, you're correct in everything that you said there. So as far as the plexiglass, yes, this is being used depending on the circumstance in classrooms and offices. I think there will expect to be adaptations by how teachers are, instructing within their classes. There'll be some adjustments that way. Plexiglass has, in many districts that I'm aware of, is kind of an option for teachers to be able to use. I think that's also part of the routines in as far as social distancing, and also increased cleaning and sanitizing in classrooms as well. So there's enough flexibility within the guidelines that, as Minister LaGrange has pointed out, there are a lot of different circumstances between classrooms and between schools and communities across Alberta, and that allows within each school and each district them to make kind of the best decisions to deal with it. And also your question in regard to potentially high-risk staffs. All districts are working closely with their staff to, if those situations are identified, and to find accommodations that will work. In all of our school divisions across Alberta, our primary goal is to keep people safe. We always have the safety of students as our primary focus. And with this pandemic, the safety of our staff also is getting additional work. So, yes, that's being worked on and looked at, I would say, in every district right now.
Thank you.
All right. Moderator, could you please put forward the next caller?
Thank you. Dan Grummett, CTV News.
Hi, thanks for taking my question. This is for either Minister LaGrange and or Dr. Hinshaw. You guys have talked a lot about being influenced by other jurisdictions. 2 weeks ago, when you announced the return to class, the Premier twice pointed to European and Asian countries who've reopened, he said, successfully. He named Denmark and South Korea just to bring up a couple. Those countries brought back grades at different times, sometimes youngest first or high schoolers first. We're not sending kids back in stages, but now you say in the last 2 weeks you've looked at other jurisdictions to influence you. So I'm wondering, what jurisdiction did you look at that influenced these changes the most? Which jurisdiction is the closest to what Alberta is rolling out? And did you look at sending different grades back at different times ever?
Thank you. And when we announced a couple of weeks ago the return to school, we did speak at that time about the fact that our jurisdictional review and evidence scan was in process at that time. So we have been looking at evidence all along. With respect to the putting different grades back at different times, I think what we've learned, as we've seen from different countries, you've mentioned a few in Scandinavia, is that there seems to be in the younger grades, again, evidence that those particular younger grades don't contribute to widespread transmission within the schools, particularly in places where overall community transmission is being held in check. And so I'll remind everyone of a comment that I made when we did talk about going back to school, which is that the successful return to school isn't just about those who are directly in the school environment, but about all of us, because of course exposures in a school environment are based on what's happening in the community at large. And it does seem like our review of the evidence and of what other jurisdictions have seen is that in places where there's widespread community transmission, schools seem to be reflecting that transmission in the community coming into the school. It doesn't seem like the school acts so much as an amplification to drive community transmission, especially in the younger grades. And we've seen that, for example, comparing Sweden and Finland, where Finland closed all their schools, Sweden kept their elementary schools open for the duration of their response, and there wasn't much difference in those two countries between the attack rates in young children and the community transmission being driven there. So again, that's one example. I would say that an influential example that we've been looking at is examples out of Israel, where they did have some significant transmission, particularly in high school settings, and there seemed to be a correlation. Again, as evidence is emerging, we have to act on what's currently available, knowing that there will be better and more robust evidence over time. But in the Israeli example, it does seem that there was a coincidence of discontinuing mask use with then the onset of some significant school outbreaks in high school age groups. And so we're looking at those examples, again, looking at the examples that you've mentioned with respect to other schools where mask use, for example, in some Asian countries has been an important part of back to school. And based on that assessment of all that evidence, as well as our own local evidence about transmission in children, this is the recommendation that I'm putting forward based on what's currently available. And as was mentioned, we will continue to look at evidence from jurisdictions, look at publications, look at documentation of transmission risks as we go forward, but we're acting on the best available evidence at this time.
Thank you. Moderator, could you please put forward the next caller?
Don Braid, Calgary Herald.
Dr. Hinshaw, when you first announced the school program, the Premier basically suggested that kids, generally speaking, weren't transmissible, and he was, I think, referring to both elementary and high school, junior high and high school students. And there was even at that time evidence that even though transmission might be lower among kids under 10, it was actually higher than adults for junior high, or a 10-year-old to up to 19. Has you changed your thinking on this? I mean, the whole original plan was based on the assumption that there wouldn't be much transmission in schools. And, of course, we've had one example the Premier cited was the Catholic School Board in Calgary, which had a summer school with no cases. Well, now they've got several. Have you completely changed your thinking on this question of transmissibility among children?
So I can't speak to the specifics of what was said a few weeks ago. We know that as the evidence has emerged, there seems to be a gradation between the younger children and their ability to transmit to others versus older children. We know from studies in households that it seems that children are less likely to be the source of infection for an adult. And when children are infected, they seem to more often have picked it up from an adult than another child. And again, this isn't to say that the risk is zero. I want to be really, really clear that it is still possible for children to get COVID and spread it, but it's just that the risks are lower. We've seen in serological studies from multiple places around the world, so there's some observation that because children tend to have milder, perhaps asymptomatic disease, they may be less likely to be diagnosed with PCR. But in the serological studies that have been done, it does seem that that age group of the under 10 are about 30% less likely to have antibodies. Again, there's all sorts of limitations with that, but as the evidence is emerging, we have to look at it as a whole. So what I would say is that the current evidence indicates that the older a child is, the more similar their transmission may be to adults. And that's, again, the reason why we've had the grade 4 as this cutoff. So with respect to our current recommendation, again, we have to go with the evidence that we have available to us, which indicates that high school students in particular wouldn't really be at much different risk of transmitting from adults based on what we are currently seeing in the evidence. And that's, again, why we've made the recommendation that we have today.
All right, thank you. Moderator, could you please put through the next caller?
Rafi Bouchakanian, CBC.
Good morning. Thank you for taking my question. I'm wondering about the logistics of high school students, say, being told that they need to have their masks on in common areas but not in classrooms. Are we expecting students to bring their different masks to school every day? Because we hear that it's not good to reuse the same mask without washing it. How much guidance will be provided in these situations?
Again, this is a learning opportunity. We are providing every student with 2 masks, 2 reusable masks, one to wear, one to take home, and then switch out and do the proper washing. With high school students, right now in society, many locations, you're required to wear masks. And so this is a continuation, as Dr. Hinshaw said, of guidelines that are out in the general public for the most part. A very good learning opportunity for our students so that they can protect themselves and others from COVID. And Bevan, our superintendent, would you be able to speak any further to this?
Certainly. So that question, I think, comes up because it's a change to practice. There's something new. But schools have been dealing with various policies, whether it's for hats or cell phones, and they will have rules that are one thing in the classroom, something else elsewhere in the school. Kids are very adaptable students, and once the norms are explained and they're worked through in the first few days, it will become part of the routine. So we're not expecting this will be a challenge.
All right, thank you, moderator. Could you please put forward the next caller?
Eva Ferguson, Calgary Herald.
Thank you for taking my question. It's a bit of a follow-up to Rafi's question, but it's specifically for Dr. Hinshaw. Dr. Hinshaw, you seem to be offering guidance on mask wearing, saying that it's mandated, yet it also sounds like it will be totally up to teachers or students to decide when they actually wear masks, particularly in classrooms. And we know many classrooms have well over 30 students in them. There's a lot of movement in classrooms, and yet I'm hearing the doctors say students may not have to wear the mask when they're sitting or not facing each other. So do you think you're creating some confusion among students and staff where they may be taking masks on and off several times during the day and then possibly increasing transmission with their hands?
It's an important question, and of course the hand-to-face movement is something that I've always said people need to be washing their hands before they put a mask on, and before and then after they take it off. So absolutely part of the routine will need to include regular hand sanitization at times when it's being put on or taken off. One of the challenges that is present with respect to giving guidance is that each teacher will have a way of running their classroom, different activities that they will be doing with their kids that will be different at different ages, at different grades. And so I think that my intention is to provide guidelines with respect to if students are sitting and not facing each other in those circumstances, then again, that would be the optional time. If students are moving around, if they're closely working together on a project, if teacher and students are in close contact, at that time the mask use would be expected. But it would be extremely difficult for me, I don't have expertise in teaching, to tell teachers what their classrooms look like. So again, what we're trying to do is set out the expectations based on quiet seated activity where students are not facing each other, as opposed to times when they might be in close contact moving around, and then letting teachers determine with respect to the activities in their classroom how they want to structure their day, their classes, and how that will work. Because they're the experts in their classroom, they're the experts in how they're running that educational experience. And so I don't see it as my place to micromanage those details, but rather to provide guidance. If teachers are finding that that particular direction is too high level and they're needing more, certainly always happy to get feedback and work on providing what level of guidance is needed. But again, I feel it's important that teachers are able to adapt this particular direction to what makes sense in their classroom.
All right, and our next caller will be our last. So moderator, could you please put through the final question?
Stephanie Marotta, Globe and Mail.
Hi, thank you for taking my question. So you said that masks won't be necessary in class except for cases when physical distancing isn't possible, in which case students won't be facing each other. But we're also hearing about how critical load is an important factor in how the virus spreads. So is there any thought to ensuring that students and teachers can physically distance, such as having those classes adopt a mix of in-class and remote learning?
I'm sorry that the audio was a little bit difficult. Could you just repeat the last part of that question?
Absolutely. Is there any thought to ensuring that students and teachers can physically distance, such as having those classes adopt a mix of in-class and remote learning?
The current approach, again, is for school boards to prepare for 3 scenarios from a health perspective. We are looking at the evidence that's currently available and determining at what community transmission threshold. From a health perspective, we may recommend a different scenario. But with respect to the current environment, again, we have recommended that the safety of students is critical, as is their ability to have access to educational opportunities and all the other supports that schools provide. So I think it's really important to remember as we're making plans for this fall, again, from a health perspective, is we need to look at the overall health of students, not just from COVID, but their well-being and all of the different supports that being in school provides. It's really clear from the evidence reviews that have been done on the topic, and you can look at the National Academies of Science, Medicine and Engineering in the US or the Canadian Association of Pediatrics. Organizations that have done the overall literature review are really, really clear that we have to look at the overall well-being of children and the importance of being in a school environment to receive the supports that are necessary. So COVID risk needs to be taken into account. We need to make sure that these are safe environments for our children. We also need to make sure that our children have access to all the supports that they need. And it's that balance that we're working to achieve in schools as well as in all of our communities, where living with COVID means that we have to try to hold those 2 things in tension and not focus only on COVID. So again, that's from the health perspective with respect to the making sure that we're putting all of those things in context. But I don't know, Minister, if you wanted to talk about the scenarios.
And what I would add is that that is why we developed 3 very comprehensive scenarios. We will be going back in scenario 1, but we have indicated to school divisions to be prepared for any scenario and to be able to be nimble enough that we will, if we need to, switch from scenario 1 to scenario 2 or to even scenario 3. So we have that availability built into our system. And my understanding in speaking with our education partners, particularly our superintendents, they feel very confident that we have a strong plan and that it is nimble enough and flexible enough to ensure that we come back in a safe and secure manner for all of our staff and our students. As we've indicated from the beginning, the security of our staff and our students, the safety of our staff and our students is paramount, and we will continue to adapt our plan as necessary. Thank you.
All right, that's all the time we had for questions, so thank you everyone for participating.